My name is Krysta Hawryluk, and I am a high school art teacher in Prince Albert, Saskatchewan. And this journey kind of started around the time when I was actually going on holidays, and I ended up going to the Medi-clinics. I wasn't feeling so well, and one thing sort of led to another, and it ended up with MRIs, finding that I had some tumors on my ovaries. And then I was referred to Dr. Hopkins, and things really went fast from there. We found out that I had borderline tumors and that my ovaries were going to need to be removed in order to prevent kind of cancer from progressing, I guess. I struggled a lot with kind of emotional and mental anxiety, just with everything going on and the possibility that I had cancer being so young. I'm only 29, so it was really hard kind of news to get when I had only gone into the doctor for stomach pains. So it was kind of a really big shock to me to find out that this could be cancer. Throughout all of this, I've kind of realized some things about, this surgery. Since I was cut from such a large area, it's kind of amazing how much you actually use all your core muscles. I wasn't really aware of that at first, but doing anything was painful. Rolling over, going to the bathroom, walking, sitting up straight has been a challenge. It's been a really long journey, and I still feel like I'm recovering. I'm a squeamish person, so seeing such a large incision with no bandages on it was terrible for me. It was so hard to even look at it, and I was encouraged to rub it and put oil on it, and just the thought of doing any of that was just so scary for me. So it was very difficult, and still it's a little bit strange because it's amazing how much nerves get affected in this. I never really thought that was going to be a thing, but there's so much numbness and just doesn't feel like it's part of your body anymore. And it's kind of something that's hard to get through your brain, that this is still a part of me, and this is the new reality, I guess.
My name is Laura Hopkins, and I'm a Gynecologic Oncologist here at the Royal University Hospital. I'm the provincial head of Gynecologic Cancer. I've been in Saskatchewan about a year now, almost, and our project for the Women Leading Philanthropy grant is called Enhanced Recovery in Gynecologic Oncology. And this project is intended to improve surgical outcomes for women with gynecologic cancer. And what we intend to do is transform surgical care at the RUH. Our team is made up of doctors and nurses, and we have roles that span the time from a patient being referred to our service for a surgical consultation all the way through to admission at the RUH for surgery, recovery at the RUH, and recovery at home for the first few weeks. And if you can imagine being a patient who's facing surgery for a known or suspected gynecologic malignancy, your life is turned upside down. The last thing you need is a surgical complication. What you really want is an absolutely perfect procedure that goes without any complications. You want to get home to your families as soon as possible. It's not just for most of our patients, but for all of our patients. It's not about meeting surgical standard of care, it's about raising the surgical standard of care. That's the essence of this culture shift.
My name is Carolyn Morin. I'm a nurse specialized in wounds, ostomy, and continence nursing, and I see many patients post-operatively. Post-operative wound complications present a variety of problems. Having people come back in hospital and requiring additional surgery causes all sorts of stress for the patient and cost to the healthcare system. If patients need to go on to have chemotherapy, having a wound can really delay that and adds more stress to an already stressful situation. So anything we can do to prevent complications and ease the transition for people to leave hospital, go home, and then deal with the next stage of their recovery is important.
The ultimate goal of an enhanced recovery pathway for gynecology patients is a normal, uncomplicated recovery from surgery for everyone. The funding is important to do this work because getting a lot of busy healthcare workers to work together, even on something simple, can be a challenge. So we need to have a project manager, basically. So someone to schedule meetings, get us together, work us through all of the elements of ERAS, allow discussion, and allow that wisdom of the frontline providers to inform the ease with which we can implement all the various things that we need to do in this project. Ultimately, this project, if it's successful, it's going to change care across the entire OR. It has been said that the OR is a complex adaptive environment. That's what they teach us at meetings about how people work together. And what that means is that when you change one thing in one place in a complex adaptive environment, it doesn't just happen in isolation. It has ripple effects that change care in other rooms because, for example, nurses move from room to room. They don't just work with one surgeon. They work with many surgeons. And the more education that one team has, the more that they can share that education with others. So improving in one site will cause improvement across all sites, because practice will change and the culture changes with it.
I want nothing more than to have other people like me have great experiences in the hospital, because I feel that, the threat of cancer is such a big thing for so many people that a hospital stay shouldn't be something that should be worrying them as well.
And we don't need to just do this in gynecology. Remember, we need to do it for everyone. We really need to change the culture, because the chance of any one of us having surgery in our lifetime is very high. And there are statistics on this. And every person in Canada will have, on average, 3 surgical procedures in their lifetime. So that means all of us are pre-op. We just may not know it right now. So it's very, very important for us to work collaboratively together to get this project done as soon as possible so we can start changing care now.